You know, leaders are calling it an epidemic. We're talking about spice use in Mobile County.
Yesterday, police told us that 4 high school students were hospitalized and 2 adults died after using synthetic marijuana. And today, several local agencies called a joint news conference to talk about the problem.
Yeah, Letitia Bush is live at the Drug Education Council building in Mobile where that press conference was held. Letitia, a lot of people getting together to talk about this.
That's right, Lenise. We're talking the Mobile County District Attorney's Office, Mobile Police Department, Mobile Fire Rescue, the Mobile County Health Department, all in this room just minutes ago, trying to alert you about the dangers of spice and how it's creeping into our communities. The Executive Director of the Drug Education Council now joins me, Virginia Guy. So for the person sitting at home now listening to this saying, my kid would never try spice, they would never get into that, what would you say to them?
Right. This is something that can affect any family. You know, parents can do everything right, but today these drugs are affecting our children at younger and younger ages. These drugs are a lot stronger, they're a lot more dangerous. So all parents need to be aware of this and need to take the steps to educate themselves and talk to their children about staying away from these harmful substances.
And for those parents who may be suspicious that their child is acting differently, moody, paranoid, having hallucinations, what can they do right now?
Right. They can get their child drug screened. We do drug testing here at our office. It's no charge to the family. This is a screen that the parent can understand exactly what drugs the child is using, and we do test for this spice poison as well.
Okay, thank you, Virginia, for that information. And you know, earlier today, I went to Bay Point Children's Hospital, and I learned that this drug is affecting some very young children. Take a look. Dr. Edgar Finn is treating children who are dealing with the side effects of smoking spice.
They're not in touch with reality.
At least one of the patients is not even a teenager yet.
We have someone in the hospital now, I believe is 9 years of age, who's been actively using synthetic marijuana.
Finn says last year he saw a similar increase of children that were suicidal, homicidal, paranoid, and delusional, all after smoking spice. The psychiatrist says most patients don't understand how unpredictable and dangerous spice is. He says they think they're in for a quick high, but end up dealing with side effects long after they smoke the drug.
We're seeing children come into the hospital who have been intoxicated by these substances, who report use in the past over the course, say, a few weeks or a few months, who end up in the hospital for several weeks, even a month at a time, while we're trying to get them back to a baseline level of functioning.
Finn says one of the best ways to protect your child from getting a hold of this dangerous drug is to know where your child is and who they're with at all times. And if it sounds like your child is smoking it now, Finn suggests you get them some help now.
Principals and teachers and parents and any child that's being seen by, say, a coach or anyone out there who has a concern about their child's safety needs to refer that child for treatment.
So there's 3 things that Fox 10 News is trying to do here. 1, we're trying to expose the problem. 2, we want to alert you to where it is, what's happening, the kind of injuries, and like you heard, 2 deaths that authorities believe is connected to spice. We're trying to alert you of that. We're also trying to empower you. If you feel like you need to treat your child, there's at least 2 options we just presented. 1, there's a phone number we're going to put on the screen right now. That's directly to the Children's Hospital. If you feel like you need treatment for your child or you have questions about treatment, and you just heard Virginia Guy talk about if you're suspicious, don't know what to do, you can talk to the Drug Education Council about doing testing to see what may be bothering your child. Reporting live in Mobile, I'm Letitia Bush.
All right, thanks, Letitia.